Welcome to another episode of Dentalflix Uncut. I am your host, Allison Lacoursiere, and I am here with Dr. Dar Radfar, aka Dr. Rad. Welcome to Dentalflix Uncut.
Thanks for having me, Allison. I'm excited to share some cool info to all the listeners.
Me too. You and I met at a dental festival probably 3, maybe 4 years ago already. And at the time, I remember thinking like, oh my gosh, you are doing so many cool things in the industry. Like, how do you even have time for all of this? And we were just chatting before the show about how you're so busy serving, helping solve big problems in the industry. Tell us a little bit about what is it that you're doing outside of being a full-time dentist? What are you doing in our industry to help and support our industry?
Yeah, my main goal is to help dentists save lives and really add revenue to their practices by treating sleep apnea, snoring, doing low-level laser therapy, understanding medical billing, even some things with social media and whatnot. And so the biggest power that we have as dentists is to speak our voice about the treatments that we provide. And what a beautiful thing it is to be able to provide a mouthpiece for patients who don't want to wear their CPAP machine or they can't tolerate it or really are mild, moderate cases of sleep apnea. And my program, RAD Seminar, basically does that. It allows dentists to learn how to not only get trained to do it, but also how to implement systems in place. Because everybody wants to do sleep, but they take a course and then the next week they stop. They don't really push forward. They don't know what home sleep testing company to use. They don't know what medical billing company to use. So I've tried to create a system. So ultimately, and if they can help a few patients, if not hundreds, those patients can live longer lives because it is now estimated 12 to 15 years off your life if you're not treated for sleep apnea.
Wow.
5 times higher risk of cancer of any kind. I fell asleep at the wheel in 2009, not knowing I had sleep apnea. And if some dentist were to look in my mouth and see the signs of what I teach, which, like grinding of the lower front teeth and scalloping of the tongue, those are a couple of things we look at. Maybe that would have had that prevented. Maybe that accident would have been prevented. And luckily I hit a tree, right? Not another human. That would have literally changed my path in my life towards something very, very challenging.
Oh my gosh, it's so important and so true. It's interesting how in dentistry we're taught these like conceptual ideas or we're taught the science behind sleep and we start to like know and understand. We're like, oh my gosh, this is so important. We need to do something. But then similar to dentists going through dental school, you learn how to be a dentist, and then you get out of school and you're like, okay, now I've got to do something. But you're not taught the business, you're not taught the systems, you're not taught the billing, you're not taught all these like really, really important tangible things. And we can have two choices: go and figure it out on your own and take 10 years to really be able to have a system, or find somebody like you who has those systems in place and can teach us how to do it and implement things faster. So I love that you teach this in like that such a practical way. So
Yeah.
was go ahead.
It's unfortunate that the university still to this day really only go over it for a couple hours. Oklahoma University College of Dental Medicine, USC School of Dentistry, where I went to, I did a talk for them via Zoom in the last few months, and they are so excited. They're like, "Wow, we could do something to be able to make a huge impact on the medical and even mental well-being of individuals by screening them for sleep and providing a mouthpiece." And it's estimated now that anywhere between 30 to 45% of depressed anxiety patients is a result of sleep apnea. I mean, the biggest word here is mental health. And really, the people listening, you're a dentist, you're a hygienist, you're a team member, you yourself could be suffering from this, or people within the office. And then what does that do, Allison? It makes the mood and the work culture. You can't be in a great, positive, let's get reviews, let's put systems in place, let's treat our patients like, their family, when you're not getting good sleep. And that's the biggest issue is sleep is definitely one of the biggest problems that are associated with work culture nowadays. And I think that's what's hard for people to understand is it's not just outside with our patients, but also within our own circle, maybe even within our own families.
Wow, that's such an interesting point. And I honestly have not thought about this before. Like I, as a high performance coach, talk to my clients like when we get on a call the very first time. I'm like, how's your sleep? And most people are like 7 to 8 hours, like I'm doing okay. And I'm like, great, we move on. But
Right.
like, what if there's an underlying issue here and they actually do have sleep apnea or there's something else going on? You're so right. Like, we're human beings first, and then we're professionals next. If we want to be great professionals, we have to have that human being aspect really outlined. So, what are some of the ways, like, I want to hear a little bit more about your course and how you're helping doctors implement this. But right now, for somebody listening, what are some of the ways that they can just like start to even screen for this or like start to even have these conversations in their practice or even like look at themselves and be like, am I suffering from this at all?
Yeah. So one of the biggest things is if you're feeling more tired throughout the day, daytime sleepiness or feeling more tired. People think, oh, I have kids. I'm juggling 10 things at one time. Of course, my sleep is being affected. Well, there's sleeping and getting quality sleep, and the quality sleep is getting enough oxygen. And if you don't get enough oxygen, your heart races to get oxygen to your brain, causing more vasoconstriction. So therefore, high blood pressure is an indicator. So whenever I look at a new patient or even an existing patient, I look at their medical history first. I see things like comorbidities, we call them, such as depression, such as high blood pressure, history of heart attack or stroke, history of cancer, diabetes type 2. We've noticed that up to about 48% of diabetic patients, their diabetes becomes a problem, meaning they're required to watch their glucose and their insulin levels because of sleep apnea. You fix the sleep, you fix all these medical conditions. So these are some of the medical conditions I look at on the medical history to go, Allison, how well do you sleep at night? Do you feel tired throughout the day? Anyone tell you that you snore? Have you ever had a sleep study, a home sleep test done? And sometimes they go, no, everything's great. And you look in the mouth and you go, yeah, I'm noticing you're grinding your front teeth because you're moving your jaw forward and grinding. That's an indication of sleep apnea because they're literally doing their own kind of mandibular advancement, which is what the mouthpiece does. It brings the lower jaw forward and keeps it that way so your airway is kept open. They're doing it in their sleep. They're grinding their teeth forward. So when I investigate in the mouth, I see the grinding of the front teeth being worn down. I see acid erosion where those near the gum line, we have what we call class 5 lesions where there's notches that occur at the root area. We see large scalloped tongue. We see the soft palate just looks really droopy, like when they stick their tongue out, and they don't have to say they just stick their tongue out. I can't see the uvula. That's what we call Mallampati 4. Anesthesiologists freak out putting someone out, but that's Mallampati 4 because if you remove the tube too quickly, the patient can suffocate, and that's what they're doing at night when they're sleeping because that soft palate is so close to the tongue. And so these are so many different landmarks. I mean, when you have 20 patients walking in for anything in a dental practice, about 30% of them have apnea. So that's around patients are coming in every day on a 20 patient schedule that have sleep
Wow.
apnea, and they're left. And you were the ones to look in the mouth 2, 3, 4 times a year for these patients on average. And we can just, if you don't want to do it or you don't know how to do it and you don't want to get trained, at a minimum, look at these
Yeah.
landmarks, right? And tell them, go get a sleep study with your physician. I'm concerned I see something here that can indicate that.
Wow. That's so helpful. I'm like, as I'm listening to this, I'm like, I'm sending this podcast to like 100 people because I like people I know because it's so helpful. You just explained that so well. 30% of our population.
Yeah,
And
and 30% of the population who's married that snore sleep in different bedrooms. That's called sleep divorce. That's a new term that I think people are hearing more and more. So that there's a lot of relationships out there that whether they're married or their partners, that they sleep in separate rooms because one's a light sleeper and the other one snores, and that can destroy a relationship. Ultimately, most sleep divorces, let's be real. The intimacy is affected. Although
Mhm.
at least they can sleep and not be resentful
Yeah.
the next day, right? But it's definitely a big challenge for these couples, so to speak. And it's also embarrassing, Allison. I mean, some of my most popular patient type now is the divorced person, right? The
Mm,
wife or husband used to tolerate. Now they're dating, and let's be adults. They get intimate, and then the next day the person's like, wow, you kept me up all night, and that there goes the relationship, right?
wow.
Not just the medical health and physical well-being, it's also kind of an embarrassing situation to snore or even get someone nudging you to be able to move so you can actually breathe. So there's a lot of implications here.
Wow. Oh my gosh. And I honestly think that's one of the unique things about you as an educator and as a teacher is that I know how passionate you are about personal and self-development. Like you are one of those people that I know who does not stop learning. And so even though you teach on sleep, I know you also teach on a lot of other things as well because you're that kind of person. You're like, let's look at the whole person, the whole picture. Like any patient that comes to your practice, I feel so lucky to have you as the person that you care for them. They're so lucky. So what are some of the other things like that you teach as a speaker, as an educator?
Well, thank you for the compliment. And I'm at the tender age of 47. I've learned over the last 3 or 4 years so many different variables of being able to handle stress, my own ego. When a patient comes in and upsets the whole office, what happens then, right? Like, why do we take it personal? Why do we think, woe is me? That kind of mentality. And these are the type of things that I've learned through retreats that have nothing to do with dentistry, through
Hmm.
personal coaches and whatnot, that I translate now into hopefully proper communication skills within my staff, understanding that when there's an assistant that's having a bad morning or they're just a little grumpy, it has nothing to do with the type of uh, care that they want to give or the type of approach that they have towards the patient. They're just bringing something home from them, and you got to have compassion and empathy towards that. And that compassion and empathy bleeds into your personal life when you can do it at work with your patients. You can also do it in your personal life. So a lot of my seminars and lectures, even when we talk about sleep, is how to handle the patients with compassion, with care, especially as dudes that when we sometimes don't have as much of that compared to females, our masculine energy takes over in a toxic way. And I learned a lot how I used to make those mistakes. And now I think it's important for us to lead with more compassion and understanding, no matter how different our differences are.
Oh my gosh, I love that so much. I think this is what I'm the most excited about in dentistry today is that like we're learning so much about the human aspect of the profession we're in. And that human aspect starts with us as individuals. Like, how am I showing up? How am I experiencing these things? How am I leading the way? How am I communicating to patients, connecting with them? And that is so fundamental that I think the more people that learn exactly what you teach, the more dentistry they'll do, the more patients they'll serve, the better like life that they will have as an individual and the longevity that they'll have in our profession. And so I'm so excited about us taking high performance and like coaching and mindset and bringing it into dentistry because what other profession is it more?
Yeah, I mean, you deal with 20 to 30 plus patients a day. You have to detach emotion from the situation to be able to lead with that compassion and kindness when you don't take things personal. And ultimately, Allison, I think truly burnout happens when you feel emotions really at high elevated emotion that is not a good emotion typically, because you have so much stress and patients that are upset. This tooth hurts since you worked on it, doc.
Yeah.
This Invisalign's not tracking and working for me, and this insurance wasn't billed right, and your staff was rude to me, and all these things that you hear. And I literally shrug my shoulders and go, thank you for sharing. We will do our best to resolve that for you.
Yeah.
And that's it. Like, it's because you can't get hyper focused on every little problem. You literally will burn out and have mental health issues yourself, let alone possible sleep issues, right?
Yeah.
So that's the key. Is you have to, if there's a new dentist that's listening to this, or one that's burnt out and tired, you've got to spend some money on yourself to educate yourself on some of the coaching that you do, Allison, or you're part of, and also adding more skills than just the crowns and fillings and whatnot, so you can feel like you're encompassing and helping the total health of a patient more than just bread and butter dentistry.
It's so true. I think this is like one of the keys to success and longevity and happiness in this career and profession. So thank you so much for sharing that. It's so helpful. Tell us about if any doctor or team members listening to you, how do they work with you? How do they connect with you? Do you have any events coming up? Like share with us What's in your scope in the next, 6 months, year? I would love to hear it.
Yeah, I'm going to be on stage actually in Florida a couple times at the Southern Florida Dental Association speaking on sleep and how to incorporate it. My website, radseminar.com, has all the information. You guys can chat with me on there too. I answer my own messages. I'll be at the CDA, California Dental Association, in 2025 in May, speaking as well. I love to get out there on stage. Lately I've been speaking on conferences that have nothing to do with dentists, sharing work to corporations, how important sleep is for work efficiency.
Cool.
People to have the right kind of mindset and mental energy to be able to work well at the office and do better sales and have better numbers and have less sick days. I mean, people wonder, how did some people get more COVID or flu symptoms, more symptomatic than others? Majority of those patients had sleep apnea. When you have sleep apnea, your immune system's affected, and that affects how well the attendance is at work. So it's really important to be aware of this, not only for yourself and your staff, but of course all the patients and all the beautiful things you can do. And through radseminar.com, that's my training and coaching. I don't just teach you on videos on how to do it. I coach you. I guide you for a few months to make sure it's guaranteed to be effective. And on average, Allison, I take pride in this. We do add about close to $200,000 the first year to the revenue of the practice within the first year. And we do. We are in the business of making, providing for our families and for our team's families. And so it is a big revenue generator once you get going and get trained right.
That's so powerful. And yes, I think we need to talk about the business of dentistry. We need to talk about what it means when we bring in these different procedures. Thank you so much for sharing this with us. We are lucky enough to have Dr. Dar as one of our creators in Dentalflix, and please go and check out his course. Inside of it, you're going to learn so much. And if you need somebody to come and speak at your event, please consider him, because he is just a wealth of knowledge and so well-rounded in bringing all these human aspects to dentistry. So thank you for all the work that you do in our industry, and definitely reach out to him.
Thank you so much, Allison, for having me on. Keep up the great work. I love Dentalflix. It's the best.
Oh, we're so lucky to have you. And so if this resonates with you, if you know anybody that's wanting to implement sleep, I just saw that you have a unicorn mug. I like you even more now because of that. Please share this episode with somebody in your network. Give us a like, give us a thumbs up, and definitely reach out to Dr. Rad, and we will see you on another episode of Dentalflix Uncut.
Sleep well.
You've just unlocked valuable insights with Dentalflix Uncut, but there's more. Dentalflix is not just a podcast. It's a thriving community, a hub of knowledge, and the #1 online streaming CE platform in dentistry. With just a few clicks, you can start exploring a wealth of resources, including in-depth training on leadership, case acceptance, scheduling, hiring, weekly marketing calls, insightful gap assessments, and scorecards, all designed to help you master what you discovered today and propel you further on your path to dental excellence. Head to dentalflix.com to get started for free and embark on your journey towards mastery. Thanks for tuning in to Dentalflix Uncut. See you next time.